Okay, so we'll just kind of go over, here, we'll do it like this. Male, female, just kind of what differences would happen. So does anyone know the value for red blood cells for females?
Isn't it lower, like 4?
It's like 4 to 5.
4 to 5, perfect.
Yeah. And then guys is pretty much 5 to 6.
Oh no, it's 4.5 to 5.5, so basically. And I would say, like, for your first semester, I think you guys have to memorize them. Did she clarify that?
We were told we didn't, but we
Okay.
were also told we
Just
didn't.
kind of know general values, though, kind of just like the general
Units
range.
per liter?
Yeah.
Milliliter?
No, I think it's smaller than a liter. Let me read. Millions per cubic millimeter. Yeah. So basically just know the general range, because she probably told you in hospitals they all have it down. They have the range, and it kind of differs a little bit for each hospital. Okay, so what is going to cause an increase in red blood cells?
Increase in red blood cells?
Mm-hmm.
Climates?
Yeah, high altitude, for sure. Also, dehydration. And then also CHF, which, what does CHF stand for again?
Heart failure.
Yeah, perfect. I like it
What
right.
was the second one you said?
What did I say?
Dehydration.
Dehydration. Dehydration, high altitude, CHF.
Does dehydration make your red blood cells go up, or just that your hematocrit goes up?
That would be talking about hematocrit. I think it just stimulates more red blood cell production.
It does? Oh.
Yeah. Because hematocrit, if hematocrit's higher, it doesn't mean you have more red blood cells. You just have more in relation to your fluid.
Mm-hmm.
Does that make
So
sense?
the percentage ratio?
Yeah. So what would decrease your red blood cells? Blood loss, so like hemorrhaging, for sure. Also, if you had a dietary deficiency in, anyone know the 3 things?
B12.
B12, yep, iron, folic acid. Yep. So if you have a deficiency in any of those, you're going to have low red blood cells. That's what helps make them.
What was it? So there's iron?
Iron,
B12.
That's right.
B12, folic acid. Perfect, yep. Okay. Also, kidney diseases can also do it. So,
They'll break down.
yeah. And then also bone marrow failure, kind of where they start making it. That's all it's kind of breaking down. Okay, just jump to hematocrit now. Hematocrit's like a ratio. So some people are kind of confused about this one, so we'll just kind of do this little ratio thing. So basically what it means, just for like demonstration's sake, we'll just say it's 50% is your hematocrit. So that means 50% is red blood cells. And then 50% is fluid, so like plasma. So if your hematocrit went high, what do you think is happening? Yeah. So it wouldn't be decreasing your red blood, it wouldn't be increasing your red blood cells, but it would just be decreasing the fluid. So if your hematocrit was like 80, that's super high, but you'd still have the same amount of red blood cells, you just have less fluid in proportion to it. Does that kind of make sense? Mm-hmm. Okay, so back to like 50. If you have 50, and your hematocrit was really low, it wouldn't be you'd lose red blood cells, you just gain a lot of fluid. So you'd be at like 30. Does that kind of make sense? So it's all just a ratio. So with dehydration, is dehydration going to increase hematocrit or decrease?
Increase.
Yeah, right? Increase it, just because you have less fluid. And then overhydration is going to decrease it. Perfect. Okay. And those are the normals for men and women. Okay, and then we have 12.
So dehydration increased it.
Mm-hmm.
Yeah, just because you have less fluid. Okay. So then we have hemoglobin. Does anyone know what hemoglobin is measuring? Or how about I ask you this? What's the difference between hemoglobin and O2 sats?
Hemoglobin is what?
How much of it you have
Yeah.
available.
Yeah.
Or how much you have to even carry.
Yeah, so how many red blood cells are capable of carrying oxygen, whereas O2 sats is the amount of oxygen that's actually saturated to those hemoglobins. Okay, so this one, they really correspond together. Hemoglobin and red blood cells.
Thanks.
Also hematocrit does too. It's like if you have blood loss, you're going to have low hematocrit. But it's basically kind of what we talked about before. So, like the same reasons why this would decrease for this. So does anyone want to tell me what would increase hemoglobin?
Would it increase hemoglobin?
Mm-hmm.
Or the same thing as an increase for blood cell count?
So what would it be?
Dehydration,
congestive
heart altitude.
Yep, dehydration, congestion, heart failure, high altitude. Then what would it decrease it?
Blood loss, kidney disease, bone marrow failure, low iron, B12, and folic acid.
Perfect, yeah. Good job. Okay. And then why do we have a difference between females and males?
Because females just have a smaller
Yeah.
body. They don't have to.
We're just
have
smaller,
as
we don't
much.
have a lot of blood. Also, menses every month. That too. Okay. So then we have white blood cells, just a general. Here. It's different with like every class. Did she give you this one?
5 to 10.
Yeah. Okay, 5 to 10. So obviously if it's increased infection, decreased immunosuppressed. And the main things you need to look for in surgery would be a low red blood cell or a high white blood cell.
And that's for both females and males. from
Yeah,
5 to
that was
10.
just an overall general.
Which
Yep.
that's when you said you'd want to notify the doctor because those would
Mhm.
be important.
Perfect, yeah, just so that you can know. Okay, is everyone good for number 4?
Yep.
Okay. So, nursing priorities and roles during inter-op period. Inter-op is during surgery. So next semester you guys get to go into the OR, which is super cool, super smelly. You smell like burnt flesh forever. Not forever, but the whole day. You're like in class like, oh gosh, it smells like burnt flesh in my nose. Anyway, so the nurse in the OR room, it's actually not the most exciting job as you'd think. They're called like the circulating nurse. At first it's cool because they come in, they bring in the patient, they transfer them from the bed they were in pre-op and transfer them onto like the little surgery bed that's like flat, take off their pillow. They want to reposition the patient. What are some things we want to remember when we reposition the patient? If they're going to be there for 4 hours or
Pressure point.
pressure points, right? So they use tons of padding. Even if it's just short surgery, they'll just use lots of padding on those bony prominences. They really make sure they secure the patient in. So there's like a billion straps just in case the patient gets out of anesthesia, because that happens kind of sometimes. They like go like this. You don't really want them to move. So you kind of strap them down, put up pressure points, kind of introduce the patient to the OR, make sure it's the right patient, right room. Make sure that they have, like, say they're getting a right hip, make sure their right hip is like initialed by the patient to make sure that the doctor knows which hip it is. It's kind of like your last check. And then they kind of go under anesthesia, get them situated, put all the sterile field on them, and then you just make sure everyone's where they're supposed to be. And then while the surgery is happening, the nurse has their own computer and they just type what's happening. It's kind of like in court when there's that person who's typing all the conversations. They're kind of that person, so they're like, surgeon is putting in pin in, right? Like things like that.
So there's a constant documentation going on.
Yeah, so they're constantly just like, so. And they kind of keep count of everyone in the room, make sure they're doing their job. I know like when students go in there, they make you write your name on like the
Listen
bottom
to
corner,
AC.
just in case you faint, 'cause then they're like,
Listen.
Emily, wake up. So it's funny. What?
I was gonna say like listen to rock music.
Yeah, they go in there, there's party. It's kind of funny. Oh, also alarming. I'm just like, oh.
Did you faint?
No.
Oh.
I
Did
don't
people have?
Some people do. Some people get queasy. Or when we were at that C-section, the dad went like pale green. And he was like watching their standing, he was like going like this, and you don't want him to fall in the sterile field, so they're like, oh. But a lot of people do.
One of our PAs did.
Yeah, nurses are usually fine because
That's how
we've seen a lot of gross things.
Yeah, when she first started working for us, before she got used to it. she
Oh,
was
really?
Yeah.
Especially because you have all the gown and stuff, so you have like that mask on. It's just so hot in there, and you're super sweaty and not super sweaty, but yeah. Okay, so they document the whole time, set up the patient before, and then they're just doing, when they're typing things out, they're also doing ongoing evaluations, just kind of like looking at the vital signs. Usually the CRNA or anesthesiologist does that, but they're just doing ongoing evaluations of how things are going. So, not as exciting as you think it'd be as an OR nurse. I thought it was going to be like sweet, like in there and everything, but
Well, it's Rexburg and Idaho Falls.
it's true. But the circulating nurse does that either way. The scrub techs are the ones that like help the doctor hold open like adipose tissue and stuff. But yeah, okay. I've even had like students, like my friends in my class. The doctor would be like, "Do you want to scrub in?" And then they were like right there with him, like holding things and helping him.
Cool.
It's really cool. If they're like a cool doctor. But yeah. Okay, are we good for number 5?
Yes.
Okay, so number 6, nursing priorities and roles during Pacu. First of all, what does Pacu stand for?
Post-Anesthesia care unit.
Yes. Sorry, let me just write this down. So yeah, post-anesthesia care unit. So this is where they go right after they come in from the OR. So the OR nurse goes to the Pacu nurse, does a little report off, kind of tells them like how it went, if there was any complications. They tell them how their vital signs were, just so they kind of know what their normals have been. They tell them how much IV fluid they've gotten. They tell them EBL. Does anyone know what EBL stands for?
Estimated blood loss.
Yeah, so estimated.
And this is what we tell them?
Yep, the nurse. Just kind of give them a little background on the patient, like patient. So in there, no complications, lost about 500 milliliters. Vital signs have been normal. LR dripping at 120 milliliters per hour. Has gotten like 300 mils of it, things like that. If they have any drain, so a lot of times they can have a catheter. Patient has catheter, and any medications that they kind of were on before, just so that the Pacu nurse can really, because it's like a really critical time after surgery when their body's kind of recuperating. So that's why we give them a report off, just so they know the whole story. So just want to give them the whole landscape of things. And usually the anesthesiologist comes in too, and he's just like, yep, and tells him about what he saw, because they're like keeping every mechanism in the body alive. Like I remember when I was in the OR once, the CRNA said, basically the surgeon tries to kill the patient, and I keep him alive. So that's kind of cool, which you guys will be going into. So, because like the doctor is trying to kill him, he's like cutting them open and everything. Then the CRNA is like, make sure they're breathing, their heart's working, things like that. Pretty cool.